Hello everybody, it's Renee, staff PT at the Kirk Center in lovely Lockport, Illinois. I want to show you a technique today that might help you at home. It's based on one of our manual techniques that we use at the clinic. So this technique does not take the place of the treatment that we do with our hands, but it's something you might try at home just to get a little more relief if you can. What you need for this technique is a floor, probably not a mat because you need to be able to slide your leg on the surface, and you need a myofascial release ball. So we have these at the clinic. It's got air in it, so it's a little soft. Something like a tennis ball would be way too hard. No tennis ball. A lacrosse ball might be okay, still hard. So what we're really looking for is something firm but soft. Soft enough that you can compress it a little bit. So that's what you need. Okay, so again, like I mentioned, this is based on a manual technique. We learned this in the Baral Institute curriculum. It's a treatment for the sacrospinous and sacrotuberous ligament, which are attached to your sacrum on the back side of your body. So if you're having hip pain, leg pain, low back pain, this might be helpful. Okay, so let's start with the technique. You're going to be on your back. And you take that myofascial release ball and you're going to tuck it behind your hip wherever it might be sore. So say it's a little sore, a little closer to my leg or a little closer to my hip. Find a spot that's like, oh, yep, that's uncomfortable. Start with one leg straight. Your other leg is in contact with that straight leg. Slowly start to tip your leg out to the side until you feel some tension right where the ball is. Then slide that leg slowly straight. My leg's still close to the other one. Once you're straight, roll that leg back towards the middle and start sliding up slow. Keep sliding up until you feel some tension under that ball. Tip that leg out to the side until you feel some tension and slide that leg down. You can repeat that maybe 5 to 10 times on one side. Sliding up, find tension, tipping out. Hopefully you'll get to go a little further each time. Sliding down, stay in contact with the other leg, rolling in towards midline. Let's do that one more time on this side. Rolling out, sliding down. Good. So what you could do is maybe move on to the next spot. Find the next sore spot and repeat that same routine again. Sliding up, sliding out, sliding down, rolling in. If you treat one side, please also treat the other side. So let's do the same thing for the other side, just so you can see again. I'm going to spin around. Okay. All right, again, bend the leg, find that sore spot under the hip. Might be close to the hip, might be close to the leg, but it should be pretty close to your sacrum, that bone in the middle of your low back. And again, start tipping out to the side until you feel tension. Slide that leg down. At the bottom, roll in. Slide back up till you feel some tension at the ball. Tip out slowly until you feel tension at the ball. Slide on down. At the bottom, roll in. Let's do that a couple more times. Good. I'm going to do that one more time because I'm actually getting a good little release here for myself. One more time tipping out. You'll see how much further my leg can go each time. Good. What you could do next is move the ball to the next spot, or you're done. So 5 to 10 times each side, placing the ball close to the sacrum wherever it might be tender along the back side of your hip, sliding that leg out to the side until you feel tension, slide the leg down, close contact with the other, roll it in towards midline, slide back up, tip out, slide down, roll in. 5 to 10 times. Always treat both sides. You can treat multiple spots at the same hip before you move on to the other side. So again, this does not take place of our manual treatments, but it might help you at home. And if you have any questions or if you need a ball, feel free to leave a comment or contact one of us at the clinic and we'll help you get what you need. All right, thank you. See you.